Hello everyone, my name is Carrie Kimsey and I'm going to be doing my final presentation on healing trauma on a micro level. This presentation will go over ways in which social workers can aid trauma survivors by utilizing assessment techniques and referring those in need for further assistance. So in this process, assessment is the first step. Assessment for trauma is important in all areas of social work where there is direct client care. The assessment process is layered and begins with assessing for trauma and, if trauma is present, then also assessing for PTSD. Assessment of individuals' strengths, resilience, and social and coping skills give us a picture of how they are set in this area and where they can use assistance. Assessing for stress is also very important, including levels of distress, difficulty, and need. While assessing, we should always attend to the individual's vulnerabilities and risk factors such as substance abuse and/or suicidality. There are several different screening tools to help us aid the process of assessing for trauma history and PTSD. I've listed just a few that the book recommended: the Traumatic Stress Schedule, Traumatic Events Questionnaire, Traumatic Life Events Questionnaire, and the Stressful Life Events Screening Questionnaire. Once we have completed an assessment, we can determine the need for referrals. The referral process includes not just determining need and obtaining referrals, but also working with the survivors to utilize the referrals. This often entails follow-up with the survivors. Types of referrals made on behalf of survivors include, but are not limited to, psychiatric referrals, supportive counseling, legal referrals, medical referrals, job-related, daycare, substance abuse, including 12-step programs, counseling and self-help centers, churches, community centers, schools, law referrals, entitlement-related, victim services, and other community resources. Those in crisis can also benefit from hotlines. Many provide 24-hour access, available anytime that survivors feel unable to cope or need extra support. Types of hotlines available include child abuse, domestic violence, suicide prevention, and general crisis intervention. One tip that I thought about that I often use and tell others to do is to always look at your local resources when you are working with clients and try to refer to those first. Within my community, we have a lot of unique types of referrals that are made. I work on the Grand Ronde Reservation for the Confederated Tribes of Grand Ronde. And so some of our referrals to our community members and or tribal members are things like local powwows. Sometimes we refer to ceremonies like our sweats or round dances. We also refer to some just getting in the canoe in our canoes and going out on the lake or going on canoe journey if you have the time to do that. So it really depends on your community and where you're working at, and really looking for those meaningful referrals that are a little bit outside of the box, I would say. And then lastly, encouraging or facilitating community connectivity is important as well, because connection, we know, enables safety, which is key for survivors' healing. Crisis management is very important when working with the survivor. After the assessment is complete and maybe some referrals are made, we need to remember that survivors may have flashbacks, be flooded with memories, or have nightmares, which can create an internal crisis that leaves them feeling out of control or off balance. Crises come in many different forms and can be set off by traumatic events, by reassessing, or by even some of the referrals that we made. Crises can happen to the people that we're working with. So with crisis, we have to remember that when someone is in crisis, they feel unable to handle whatever it is that is occurring. So crisis management requires an individualized approach that fits the situation. Intervention can help with processing of a crisis. Crisis intervention is brief, limited, and active. And here are the steps. Here are some steps for crisis intervention. So safety, assessing the safety and determining the needs. Connection, interacting considerately in order to establish safe connections. Key issues, so determining the key issues involved, including what set off the crisis. Emotional difficulties, exploring related emotional difficulties that the client is experiencing. And then current coping, evaluating what types of current coping they have. Coming up with a plan to support coping and support healing, and then arranging for follow-up as required. So moving forward, I wanted to touch on the types of referrals or the micro-level healing that we can support survivors in. One of the most popular types of healing or referrals that we'll probably make is individual, couples, and family therapy. Many trauma survivors are referred to therapy to talk about what happened in detail with the aim of promoting healing. Survivors need safe relationships with individual, couples, and family therapists. During therapy sessions, social workers help to heal survivors by bearing witness to their pain, but also remembering to maintain internal safety for ourselves. The goal throughout therapy is to move away from the past, where trauma, emotions, and memory reside, and towards being fully present in the moment and ultimately regaining safe balance. Another popular referral that we'll probably be making is group therapy. Group therapy is a referral that can be made for survivors and can help trauma survivors heal in many different ways. Mutual aid is one of the major benefits of this group, or of group therapy, and is a powerful force for survivors who feel alone with their suffering related to the memories of traumatic events and associated emotions. So one of the great things about group therapy is survivors can help survivors. A lot of the times you see connection happening in groups with the group members, safe and supportive relationship building, survivors offering other survivors support and tools to get through some of the things that they're doing. But mainly, I think it just offers people the feeling of not being alone in their own traumas. So here are some other trauma interventions. One is the eye movement desensitization and reprocessing, or EMDR, guided imagery and hypnosis, dream work, dialectical behavioral therapy, breathing, relaxation, dance, writing, music, and spirituality. So again, just really thinking outside of the box when it comes to working with trauma survivors. I think the last example here, relaxation, dance, writing, music, and spirituality, those types of things can really happen alongside other referrals that you've made, and just kind of building that safety plan around the survivor and making sure that they have multiple different areas to either access healthy coping skills or just different ways of healing on their journey. So in conclusion, I wanted to just remind everyone we've learned about this a lot throughout this class. Just really remember to tune into yourself while providing these services and protect yourself from secondary trauma. And then always just allow yourself the self-care that you need while we do this really heavy type work. Nobody is perfect. I'm sure a lot of us have gone through our own traumatic events. So just remembering that when we're working with others, that if we can't help others if we don't support ourselves first and really come from a healthy place first. So I hope that this presentation was helpful, and I'm excited to watch everyone else's, and I'm just really excited to see everyone at graduation this week. So thank you all. Bye.